If you're a woman experiencing increasing challenges with physical intimacy or desire as you're getting older, let's talk about a molecule that might be part of the problem and the solution. I'm Dr. Nicole Berkins, licensed clinical psychologist and board-certified nutrition specialist, and I want to share with you why nitric oxide is so important for your sexual health and wellness, particularly as we get into middle age and beyond. Typically we think about blood flow and nitric oxide for men who are experiencing things like erectile dysfunction or sexual dysfunction issues. But the reality is blood flow and nitric oxide are absolutely as important for women when it comes to sexual health and sexual function, especially as we age. When we get towards perimenopause and into menopause and estrogen levels start to drop off, one of the things that happens is our nitric oxide levels decline. And that has an impact on blood flow to the pelvic region that is needed for supporting things like desire, lubrication, and pain-free sexual activity. So why is nitric oxide so important? And maybe you're even asking, what is nitric oxide? It is called the miracle molecule because it is a gas that the body produces that is important for so many aspects of our health and function. And fundamentally, what nitric oxide does is it allows for healthy vasodilation, meaning it supports our blood vessels to be able to expand and contract in healthy ways that allows blood to flow through the body to everywhere that it needs to go. This means that we can have healthy blood pressure, we can have healthy tissues, healthy organs. Healthy blood flow, which is supported by healthy nitric oxide levels, allows oxygen and nutrients to get to all the organs, tissues, and cells where it needs to be. So you can see how nitric oxide supports so many aspects of health and wellness. But when we're thinking about sexual wellness and sexual function, this is important not only for men who are experiencing these issues, but also for women, especially as we get older. There can be many, many factors, obviously, that are involved with sexual wellness and sexual challenges that we experience as women. But I find that this piece around nitric oxide levels is often not talked about in this conversation, and it's really something that is simple for us to support. We can support healthy nitric oxide levels even as we age by doing something called taking in enough dietary nitrates every day. Nitrates are found in produce like spinach, arugula, bok choy, beets. Those are nitrate-rich vegetables, and our body can take that nitrate and convert it into nitric oxide. And that nitric oxide then supports healthy blood flow throughout our body, including to the areas that are necessary for supporting tissue health, lubrication, and desire and pain-free sexual activity. So if you are a woman who's experiencing challenges in those areas, especially if you are getting into those perimenopausal or menopausal years, it's important to look at the role that nitric oxide might be playing and to take steps to improve and support healthy nitric oxide levels as you go through these stages in your life. That can be through eating a healthy nitrate-rich diet, through getting enough exercise, sleeping well, breathing through your nose, taking a dietary nitrate supplement every day to ensure you keep those levels up. There are lots of options, but the important thing is that you're aware of the role that nitric oxide plays in these issues, and you're empowered to take some steps and do some things that will support that. So you can talk to your healthcare provider about the role that nitric oxide may be playing in these sexual function issues for you and solutions that may be appropriate for you. You can go to the link in our bio to learn more around the science of this and have a conversation with your healthcare practitioner. If you're a practitioner listening to this, I encourage you to go to our website, berkeleylife.com, to get more information about the science behind nitric oxide and female sexual function, and to be able to bring this life-changing information and solutions to your patients.